Hello, my name is Dr. Lemrex, and I will be performing your cranial nerve examination today. So I understand you are here today for this examination because you sustained a head injury recently, is that correct? Okay, so when did you sustain the head injury? Okay, and how have you been feeling since then? Okay, so do you know what a cranial nerve examination is? Okay, well, I am very happy to tell you about it. So a cranial nerve examination is performed for two reasons. The first reason being when the patient has had a stroke or is showing signs of a stroke. And the second reason is when the patient has sustained some form of head injury or trauma. In your particular instance, as you have sustained a head injury, we are performing this examination today just to make sure that you are functioning properly. So I do have a little sheet to show you here. So this is the 12 major nerves that are made up in your brain, and these nerves innervate and control sensory and motor functions throughout your face, your ears, and downwards, mostly in the face. And what we do is we examine each of the 12 nerves of the brain just to make sure that they're all working in a reasonable manner. Sometimes after a stroke or with signs of a stroke or after a head injury, one or more of these nerves can be impacted, and the reason we perform a cranial nerve examination is that it is a non-invasive method of examining how bad a brain injury could be for you. Obviously, this is not a definitive examination. This just helps assist us with any diagnosis that we need to make for the patient. Okay? For your particular instance today, again, this is a precautionary method that we wish to take just to make sure that you're okay. Okay? So I typically like to tell my patients about the cranial nerve examination as I perform it, just so that they understand exactly what I'm doing and what I'm performing and the reasons for it. So if you have a quick look here, it just explains very briefly for you what each nerve does. And we're going to be examining every single one of these nerves today. This is extremely uninvasive. This is a very gentle and simple examination, so don't be concerned at all. So let's begin with your blood pressure first before we dive into the cranial nerve exam. So do you have any questions for me or anything you'd like to tell me before we begin? Okay. So this is basically your typical physical exam of the face combined with an eye exam and a hearing test. It dips from a variety of different medical pools. All simple though, nice and gentle. Okay, so let's begin with your blood pressure before we begin, okay? Alright. So I normally like to take my patient's blood pressure alongside a stethoscope just to get a nice accurate reading. So let's start with this arm. Put your arm in the cuff for me. Perfect. A little bit of a squeeze. Okay, perfect. And the other arm. this one in now. Yeah, just like that. Perfect. Okay. Perfect. Okay. So you can feel free to move around on the cuff now. Perfect. Set your blood pressure done. So now I'm going to have a listen to your heart and lungs before we begin the cranial nerve examination, okay? Okay. So if you could please expose your chest for me so I'm able to get the stethoscope to it. Be sure to warm it up for you. Perfect. Okay. Okay, just listening to your heart. Okay, perfect. Okay, now I'm going to listen to your lungs. Okay, breathe in for me. Breathe out. Good. Breathe in. Breathe out. Good. Again, breathe in. Breathe out. Good. Okay, shallow breath for me. Nice quick one. Good. Again. Good. Okay. Now I'm just going to slide the stethoscope to your back. I'm just going to listen to your lungs from behind, okay? Okay. It's normal breathing for me. Okay. Now, big, deep breath in. Perfect. And again. Perfect. Okay, a couple of shallow breaths for me. Okay, a few more. Perfect. Okay, brilliant. Okay, well, your heart and lungs sound wonderful, and your blood pressure is good, so I am happy to move forward with your cranial nerve examination. Okay. So the first nerve that we are going to be testing today is your olfactory nerve. This controls your sense of smell. So what I'd like for you to do for me is to please close your eyes, and I'm going to open up 5 different bottles for you. That's perfect, yeah. Now I'm going to put the bottles beneath your nose. Take a gentle whiff of each of the scents. Try to identify them for me if you can. Okay. Here's your first scent. Okay, would you like to go again? Okay. Okay. Cinnamon, yes, good. Okay. Alright. Let's grab the second bottle. Lemon, perfect. Third one. Coffee, perfect. Fourth one. Mint, perfect. And the fifth one. Okay. Orange, perfect. Okay. So now we're going to be examining your optic nerve. This is your second major cranial nerve, and it It is located right here in the brain, and this controls your vision. This is just a sensory nerve, so some of your cranial nerves have a mixed response of sensory and motor function. This is exclusively a sensory nerve. So the way I'm going to be testing your optic nerve today is by showing you two different Snellen charts, one large, one small, and I'm going to be testing your vision and how you observe each of the letters on the chart, okay? So please begin by closing your left eye and covering it with your hand. Perfect. So, with your other eye now, please try to identify the letters to the best of your ability to where I point. Up here, you can take your time. E, perfect. Same eye again. Let's try the second line here. F, perfect. Okay, let's try the second letter here. Same eye. P, perfect. Now if you could please close the opposite eye and open the other eye. Perfect, with your hand covering it for me. Perfect, okay. Now with that eye, please try to identify the letters on the third line here. T, good. What about this one? Take your time. O, good. This one. Z, good. Okay. Same eye again. Let's have a look at this line here. Start with this one. L, good. This one. P, good. Third one. E, good. This one. D, perfect. Okay, now feel free to open both of your eyes. Good, and let's have a look at this line. P, good. About the second letter here. E, good. This one. C, good. F, good. D, perfect. Okay, and with both your eyes open again, let's try this line here. E, perfect. D, good. About this third one here. F, good. This one. C, good. This one here. Z, good. And this one. P, perfect. Okay, now this line here will be a little bit harder. Let's give this one a go, okay? Okay. F, good. Take your time. E, good. L, good. O, good. P, good. Z, good. D, good. Now let's try this line here. Let's give this one a go with both eyes again. Yep, no rush. D, good. E, good. F, yep, good. Try this one. P, good. This one? What do you think this one is? O, good. This one? T, good. This one? E, good. And this letter here. C, perfect. Now, let's try one of the lines here. Let's try this top one here. Okay. Good. 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 D, good. P, good. C, good. T, good. Brilliant. Okay, now let's examine the optic nerve with a smaller chart. So, with both of your eyes open, first letter here, E, good. Now close your left eye and just with your right eye, let me know what these letters are. L, T, good. Now close the opposite eye, open the other eye, perfect. Third line, F, good. P, good. This one, H, good. Okay, the opposite eye again, perfect. This line, O, good. This one, L, good. C, great. F, perfect. Opposite eye again, perfect. Thank you. This line, D, H, good. J, good. B, good. S, good. Opposite eye again, perfect. Thank you. This line, E, good. P, good. T, good. Z, good. O, good. And now both eyes for me. Brilliant. I'm going to have a look at the last two lines now, okay? Starting here. Take your time. C, good. F, good. D, good. H, good. What about this one? J, good. Okay, last line. Take your time. Both eyes. What do you think this one is? L, good. This one? T, good. What about this one? F, good. P, good. What's this last one? H, perfect. Very good. So now I would like to test your vision of colour. I'm going to be showing you various circles, and I would like for you to let me know what numbers you see inside the circles, okay? So with both eyes open for this, I'm going to be pointing to different circles. Let me know what numbers you see. This one here. Good. This one up here. This one. This one. This one. This one. This one. this one, this one, and now can you read along for me the numbers? Okay, good, 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 good. Perfect. So with 5 other examples now. This one, good. This one, good. This one, good. This one, good. And this one, good. Perfect. Okay, so now I'm going to be testing your ocular motor nerve. This is tested with 3 different examinations. I'll just show you the nerve up here. So the ocular nerve is tested firstly by inspecting your vision with a pen light. So I'm just going to be using a pen light to just have a quick look at your eyes. I won't ask you to do anything other than just keep them open, and I'll just gently inspect them with a light. Second, I'm going to be asking you to look at 2 different objects, one close to you and one far away, whilst you keep your head still. And the third test is bringing an object close to you and you letting me know when it goes blurry, okay? Okay. So how are you with bright lights normally? Are you okay with them? Okay. So do I have permission to touch just gently around your eyes and have a look inside your eyes with the light? Okay, thank you. All right. Okay. Just keep your eyes relaxed. You don't need to open them too wide at all. That's brilliant. Okay, look down for me. Okay, good. Can you look up for me? Okay. Can you look down for me? Can you look up for me? Good. Okay, I'm just going to gently touch your eyelids now. Feel anything? No? Okay. Nothing painful, sensitive, anything like that? Okay. So I'm just testing your ocular motor nerve with this examination. Okay. Very good. Thank you for being so patient with me. I really appreciate that. You're doing brilliant. Still feeling comfortable, yeah? Okay, good. Okay. Good. Motor responses are very good. Okay, perfect. So now I'd like you to keep your head still, and I'm going to instruct you to look at an object that is close to you and far away from you. So I want you to just bring your gaze back and forth as I tell you to do so, okay? Okay. So let me know which object is closer. The pen, good. Okay. So bring your eyes, also the blue object and the gold object, okay? This is the gold object, this is the blue object. Okay. Bring your eyes to the gold object. Now the blue object. Gold object. Blue object. Gold object. Blue object. Blue object. Gold object. Blue object. Gold object. Gold object. Blue object. Gold object. Blue object. Gold object. Blue object. Gold object. Blue object. Blue object. Gold object. Blue object. Gold object. Blue object. Gold object, good. Blue object. Gold object. Gold object. Blue object. Gold object. Blue object. Gold object. Blue object. Gold object. Blue object. Blue object. Gold object. Blue object. Gold object. Blue object. Blue object. Blue object. Gold object. Perfect. So keep your head still for me now and fixate on the tip of this pen. So I'm going to bring this pen closer and closer and closer to the tip of your nose, and I want you to let me know the second it goes blurry, your vision, okay? Keep your eyes fixed on it, okay? Good, and again. Good. Again. Good. Now let's do the gold object. Same thing. Follow with your head still. Alright. Again. Good. Again. Good. One more time. Okay, brilliant. Okay, so now we're going to be studying cranial nerve number 4, which is your trochlear nerve. Your trochlear nerve is located right here. And I'm going to be examining this nerve today by having you follow this pen light for me. Okay? So I'd like if you can please keep your head still as you do so, and I only want you to move your eyes in the direction that the light is going, okay? Okay, let's start here and just follow the pen, okay? Just follow the light for me. Left, right, good. Okay. Just keep following the light for me. Good. Just keep following the light. Right, left, up, down, up, down, diagonal now. Just keep your head still, doing brilliant. Just follow the light. Follow the light. Left, right, left, right, good. Left, right, up, down, good. Left, right, left, and right, good. Diagonal, good. Good. Just keep following the light as best as you can. Diagonal again. Good. Up, across, down, across, up, across, down, across, up, down, up, down, left, So now we're going to be testing cranial nerve number 5. This is your trigeminal nerve, which is the largest cranial nerve. So your trigeminal nerve is located right about here in your brain. So this has both sensory and motor functions. And I'm going to be testing your corneal reflexes, your light sensation, and your deep sensation. So I'm going to begin by touching your lateral sclera, which is by your eye, and all I'm going to be doing is checking for a blinking response for your eye. This won't feel uncomfortable at all. I'm just looking for a blinking response, okay? Okay. So I'm going to use a nice, soft, fluffy object for this, nice and soft. Okay, so I'm just going to draw close to you, if you don't mind, with the fluffy object. And I'm just going to get close enough to cause you to blink, okay? Okay. So, do I have permission to approach your eye with the fluffy object? Okay. Alright. Good. And let's do your other eye. Good. And again. Good. Good. Just going to test your blinking responses a few times. Good. Just having to approach your eye directly, ever so slightly. Good. Good, you're doing very good. 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 Just a couple more times with the fluffy object. Good. Good. Perfect. 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 Brilliant. Okay, so now I'm going to ask you to close both of your eyes now, and I'm going to be testing your light sensation. So the same fluffy object will be touching your forehead right in the middle. And I'd like for you to let me know when you feel that object brush against your head. Okay? Keep your eyes closed for me. Perfect. Good. 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 So now, keeping your eyes closed, I'm going to use the same fluffy object. I'm going to glide it against your eyelids, and I'd like for you to let me know what eyelid is being brushed. Okay? Good. Yep. Good. 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 Perfect. So now I'm going to be testing your deep sensation. So I would like if you could again close your eyes for me, and I'm going to press against your cheek a soft object and a very, very slightly sharp object. Be nice and gentle, I promise you. And I would just like for you to let me know if you feel the sharp object or the soft object. Okay? Okay. So it would be just this item if you want to open your eyes. It's just going to be the wooden end or the fluffy end. Okay? Okay, close your eyes for me. Good. 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 Perfect. Perfect. Good. 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 Perfect. Okay, so now I'm going to be testing your sensation of temperature. So I would like if you could please keep your eyes closed, and I will be placing a warm object and a cool object against your cheek, and I would just like for you to let me know if you feel something warm or something cool. Okay? Good. 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 So now I'm going to be moving on to examining your 6th cranial nerve, which is your abducens nerve. So this innervates some of the muscle inside your eye, and the abducens nerve is located right here. So the way I'm going to be testing this nerve today is just by having you follow my finger, okay? So I'd like for you to keep your head still and just follow my finger, okay? Okay. Good. Good. Just keep your head still, just as you follow my finger, okay? Brilliant. Left, right, left, right, left, right, left, right. Good. Up, down, up, down, up, down, left, right, left, right, left, right, up, down, up, down, up, down, left, right, left, right, up, down, left, right, left, right, up, down, up, down, left, right, 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 up, down, left, right. Perfect. So now we're going to be moving on to cranial nerve number 7. This is your facial nerve. Facial nerve is located right here, and this examination will include me asking you to perform a variety of different facial expressions. So to begin with, I would like if you could please smile as wide and as big as you can. Okay, now I would like if you could please raise your eyebrows as high as they can go. Good. Now I would like if you could please frown. Good. Now I would like if you could please puff out your cheeks. Good. Now I would like if you could please close both of your eyes as tightly as possible. Okay, perfect. So now to test this nerve, I'm going to be asking you to taste different flavors. And I would like if you could please let me know if the flavor profile is sweet, salty, sour, or bitter. Okay? So I have some flavored sticks for you. So if you could please place your tongue out, and I'm just going to place the flavored stick on your tongue. Okay? The first flavor. Okay? Good, bitter. Next flavor. Sour. Third flavor. Salty. Good. Next flavor. Sweet, good. Next flavour. Sour, good. Next flavour. Sour, good. Next flavour. Salty, good. Next flavour. Bitter, good. Next flavour. Sweet, good. Next flavour. Sweet again, good. Next flavour. Sour, good. Next flavour. Salty, good. Next flavour. Bitter, good. Last flavour. Sour, good. Okay, so now we're going to be testing cranial nerve number 8. This is your vestibular cochlear nerve. Your vestibular cochlear nerve is located right here. So today I'm going to be testing this nerve by testing your hearing, and I'm also going to be testing your ability to stand and walk. So I'm going to be testing your hearing individually, so I would like to whisper different words, numbers or phrases into each of your ears, and I would like if you could please repeat them back to me. Okay? 40, 21. 40, 21, good. Clock, cow. Clock, cow, good. Sheep, dragon. Sheep, dragon, good. Truck, tractor. Truck, tractor, good. 1, 10, 3. 1, 10, 3. Brilliant. 6, 5, 4. 6, 5, 4. Good. 20, 10, 2. 20, 10, 2. Cat, dog, mouse. Cat, dog, mouse. Good. Sheep, fish, shelf. Sheep, fish, shelf. Good. Hand, arm, foot. Hand, arm, foot. 6, 12, 1. 6, 12, 1. Sunflower, daisy, rose. Sunflower, daisy, rose. Perfect. So now I'm going to be testing your hearing with a tuning fork. The way I will be performing this examination is I will be playing the tuning fork into each of your ears individually, and I would like for you to let me know when the sound stops. Okay? So if you could please cover this ear, it's perfect. And then I'm going to play the sound, and I'd like for you to let me know when it stops. Okay. Good. And now the other ear, if you could please cover this ear. Perfect. Good. And again. Okay, and again. Okay, now let's go back to this ear. If you could please cover that ear. Perfect. One more time in this ear. Good. Let's go back to this ear again. Good. And one more time in that ear. Okay, very good. So to test this nerve, I'm also going to ask you to please stand up. Okay, and I'd like if you could just please walk from one end of the room to the other and then sit back down for me, okay? So just begin over there, walk over there and come back. Okay. Okay, perfect. I was just examining your posture. So now we're going to be moving on to examining your 9th cranial nerve, and that is your glossopharyngeal nerve. So this is a mixed nerve. This has sensory and motor functions. The glossopharyngeal nerve can be located right here. And the way that we test the glossopharyngeal nerve is I'm going to be having a look inside your mouth and observing your soft palate. Okay? So I would like if you could please put your tongue out for me. Okay, do I have permission to touch your tongue and your mouth and inside it? Okay. I might need to use my light here. Okay, just leave your tongue out for me. Okay, now move your tongue from side to side. Okay. Okay, now I would like if you could do a big fake yawn for me. Okay, and one more. Okay, perfect. So now I'm going to be examining your 10th cranial nerve, which is your vagus nerve. This translates from the Latin root wandering. So the vagus nerve is located right here. This controls movement, sensation, and I'm going to be testing this nerve today by observing your ability to speak and swallow. So, if you could please pick up the cup of water right there, just take a small swig of the water, please. Okay, now I would like for you to take another swig, put the cup down, hold it in your mouth, and then swallow. Okay, perfect. Just want to have a look at your reflexes and seeing how the water goes down. Brilliant. So now I'm going to ask you some questions, and I would like for you to answer them in full for me. So if I ask you, what is the date? You would say, today's date is such and such. Okay. So, what is your full name? Okay. When were you born? What is your favorite color? Do you have a favorite animal? Okay. What country do you live in? What color are your eyes? Okay, perfect. So now we're going to be examining your 11th cranial nerve, and that is your accessory nerve. Your accessory nerve is located right here, and this is one of your lowest cranial nerves, if not the lowest. And today I'm going to be testing your cranial nerve by asking you to shrug your shoulders and drop them. So if you could please begin by raising your shoulders and drop them. Okay. Now I would like if you could keep your shoulders raised, and I'm going to press down on your shoulders with my hands. Now I'd like for you to try to resist my hands, okay? Okay, so work against the tension. Good. Okay, relax your shoulders, bring them back up once more. Perfect. And again, once more. Perfect. Perfect. So now I would like if you could please keep your shoulders still and turn your head left and right. Do that for me. Okay. And again, left and right. Good. So now I would like if you could turn left for me, and I want you to hold that pose, and I'm going to be gently pressing against the side of your head as you do that, and I would like if you could try to resist my hand as you hold that pose, okay? Perfect. Now do that on the other side over there. Okay. Perfect. Now let's do that again on this side. Perfect. And turn that way. Perfect. So now we're going to be moving on to testing your final cranial nerve. Your final cranial nerve, your 12th cranial nerve, is your hypoglossal nerve. The hypoglossal nerve is located right here. And we are going to be examining this nerve today by inspecting your tongue. The word hypoglossal comes from the Greek meaning under the tongue, and that is in part what we will be examining today. So, I would like if you could please raise your tongue as far as you can up to the roof of your mouth. Okay? Now I would like if you could press your tongue into the side of your cheek right here as hard as you can. Okay? Now I'd like if you could do that on the other side. Good. So now I'm going to be touching your cheek as you perform that same maneuver again. Okay, so tongue to this side. Try to hold that. Okay, and your tongue to this side now. Perfect. So now I would like for you to say the words la, ta. La, ta. Good. Say that again for me. La, ta. La, ta. Excellent. And one more time. La, ta. Perfect. So you have completed your cranial nerve examination. You performed exceptionally well through all of the examinations that you did today. I see absolutely no cause for concern with any of your cranial nerves, and I suspect that you will be recovering from your head injury very well. So I'd like to thank you today for your patience and for coming in and allowing me to examine you today. However, if you do happen to have any further problems with your head injury, do feel free to come visit me again or your GP, and we will take a further look at your head injury. Okay? Okay. Well, thank you very much for coming in today, and I hope you have a lovely rest of your day. Take care. Goodbye.